Time permitting, I have two cases, but let's see how it goes. 62-year-old man with hepatitis B, E antigen negative, immune reactive chronic hepatitis B, who's been on tenofovir for 2 years. He feels well. 8 months ago, his ALT was 24, HBV DNA undetectable. His FibroScan showed stage 4 disease, so that's cirrhosis. His labs now are the same. Hepatitis B surface antigen remains positive. His ultrasound shows a coarse liver echo texture and no mass. Which of the following would you advise now? Stop tenofovir, continue tenofovir, add PEG interferon, or do an MRI of the liver? Continue tenofovir is the most popular answer, and I think that's right. I think the MRI of the liver would be okay. An MRI of the liver is a little better for detecting hepatocellular carcinoma than is an ultrasound, but generally we'll do one or the other. Sometimes we'll alternate them, do ultrasound at 6 months and MRI 6 months later. So I probably wouldn't do an MRI now, although it's certainly a reasonable thing to do. But continue tenofovir is what I'd like in this patient. So I think the key things about this case, and it brings up stopping hepatitis B therapy in patients with chronic hepatitis B. So, and remember, these are not surface antigen negative patients. These patients still have hepatitis B. The question is, do you need to continue therapy? So I'm going to give you some guidelines about which patients you might consider stopping therapy. In this case, the key things are that the patient, when he started therapy, was E antigen negative. He's had an HBV DNA negative, undetectable for, sort of almost a year, but he has cirrhosis. So that's the key thing. And in a cirrhotic patient, basically, you don't want to do this. You don't want to stop hepatitis B therapy. Because the problem is a significant number of these patients, when you stop therapy, will get a flare of disease, and a cirrhotic patient just is less likely to tolerate that than somebody that doesn't have significant fibrosis. So again, PEG interferon, not so enthusiastic, especially in a cirrhotic patient. Some of you may be thinking about combination therapy, PEG interferon, and an oral drug. One study suggests that maybe you may have a little higher chance of clearing the surface antigen, but it's not very much and probably not worth it. And again, we talked about the MRI that I wouldn't necessarily think would be required at this time.